In terms of the bladder cancer program here at Henry Ford, I'm a medical oncologist, which means that I give medications for cancer. So there's different kinds of medicines that we can give.
We can give chemotherapy and immunotherapy. Some patients may qualify for targeted therapy with oral medications. There's also a new class of drugs called antibody drug conjugates.
What antibody drug conjugates are, it's a special kind of targeted therapy where the chemotherapy is brought in by that antibody to the cancer. So the outlook for bladder cancer is definitely improving, and the way we're making forward progress is through clinical trials and research. We have drugs available today that we didn't have 10, 20 years ago, and it really is making the outcome for cancer patients better. So immunotherapy, antibody drug conjugates, targeted therapy are all new kinds of therapies that we can give for bladder cancer now. One very exciting thing is that when we combine them, we've actually found that the outcomes are actually improved compared to standard chemotherapy alone, and is likely to become the new standard of care, even taking over the traditional chemotherapy. I've heard it said that clinical trials, that's the way we give patients today the treatments of tomorrow. I do my very best to try to make sure my patients have access to clinical trials at Henry Ford.